I'm Dr. Magda Perenelle here at Revolutions Naturopathic. I've been a naturopathic doctor here for 4 going on 5 years. Today's presentation is about polypharmacy. Definition of that is basically the administration of more than 5 medications at a time, which is very prevalent in our senior citizen population. So those are people age 65 and over. I'm going to be talking about the side effects and interactions and some of the complications of having a senior or anybody under 5 medications or more. CDC Statistics, it is estimated that people over 65 is about 50 million. These statistics are the latest ones, which are about 2016. CDC should be up and updating that pretty soon. So that equals to about 1 in 7 Americans being age 65 or older. As technology with science and healthcare have improved, we are living longer. So it is not surprising that we do have quite a bit of a growing senior citizen population. So what is the issue with polypharmacy? Well, there's something called a prescription cascade. For example, um, your elderly patient may come in and complain of insomnia, so they are given a prescription. Well, after some time, they may realize that the prescription is making them drowsy. So they go back and tell the practitioner, and it's interpreted as a medical condition versus an adverse effect. So then the doctor gives them a second medication to control what they interpret as a medical condition. So they give a stimulant. Well, the stimulant gives them the side effect of tachycardia. Then the practitioner may also interpret that as a medical condition and give them a beta blocker since they are a senior person. And that beta blocker may in turn give them depression. So as you can see, instead of the doctor taking care of the first prescription and interpreting it as a possible side effect, they are dealing with just patchworking of what they think are medical conditions from each drug. And so that patient may end up with 3 to 4 medications based off of the first complaint, which was insomnia. So there are many factors that are involved in the polypharmacy issue. You have age-related physiological changes as we get older. We have comorbidities that are going to be prevalent in our elderly population, such as diabetes or high blood pressure. And then there's the issue with having multiple providers. Okay, so scenarios that lead to many prescriptions at once. Simple things that we may overlook, but a patient may have hearing difficulty and may not hear directions, prescription medications, times, dates, anything that is important very well. They may have ambulatory difficulties of getting to their doctor visits, or nurse practitioner visits, or naturopathic doctor visits, and that can confound and complicate keeping track of what they need to be on. Doctors in the conventional world have less time to deal with each patient individually, so they may not take their time when someone is a little bit slower in when they are having difficulty hearing or moving around to get to the appointment. Also, changes are not monitored very well, like the reaction to a pill, and we discussed that when we talked about that prescription cascade. Also, changes like if the patient needs more of the medication or less of the medication, that may not be monitored properly. And the onset of worsening conditions, these are examples of changes that are not being monitored very well. Also, if the patient is incapacitated or not coherent, who is the patient's caregiver? Is it a family member that maybe has a vested interest in their health? Is it a someone who doesn't have a lot of experience taking care of patients. Okay, factors of multiple medication in the population. So we talked about um, things that can confound polypharmacy. One of the things that we have to be aware of as practitioners is the altered clearing of the medication. So kidney function declines naturally as we age, but we may have to keep track of that a little bit more diligently with our elderly population when we are prescribing medication. Something that's very important as well is the first pass metabolism declines as we age, specifically the CYP 450 system. And it is estimated about 50% of our drugs go through that CYP system. So we have to be careful when we are prescribing medication. Not only that particular medication, but other drugs that will compete for that liver pathway. So interestingly enough, absorption does not decrease very much as we age, but the presence of other drugs may interfere with a particular prescription. Um, Also, we have to be mindful if they cannot, the patient cannot access the drug, they're reliant on the caregiver. And once again, it's very important on keeping track of who is the patient's caregiver. And also, mental health is an issue, whether there's depression, anxiety, dementia, or senility that can decrease compliance with our elderly population. So I have a slide here of examples of similar sounding medications that are very important that we do not confuse. The first one is bupropion and buspirone. Bupropion is also known as Wellbutrin or Zyban. It is an antidepressant. It is used for smoking cessation as well. And buspirone, is also known as Buspar. That also is helpful for anxiety and smoking cessation. So even though the effects overlap, they're not the same. The dosing is not the same as well. The second line is hydroxyzine, hydralazine, and hydrochlorothiazide. They too also sound very similar, but they're very different as far as what they do. Hydroxyzine is a strong antidepressant. It's also a first generation antihistamine. Hydralazine is a vasodilator, helps with congestive heart failure and high blood pressure. And hydrochlorothiazide is simply a diuretic that can help with high blood pressure. Celex and Celebrex, very similar sounding. One is an antidepressant, and Celebrex being a COX-2 NSAID for joint pain, dysmenorrhea, and so forth, which is probably not going to be in our elderly population, but joint pain definitely is. Fourth line is diazepam and diltiazem. Diazepam is also known as Valium. That's a benzodiazepam, and diltiazem is for high blood pressure. Fluoxetine and duloxetine, even though they one starts with the FLU and the other one DUL, they have the cetine ending on the name, which people can easily confuse. Fluoxetine is Prozac, it is an SSRI, and duloxetine is Cymbalta. It is an antidepressant, but it's an SNRI, so we have to be careful with not mixing those two. Then we have Lamictal and Lamisil. They look very, very close with each other. And Lamictal is a mood stabilizer. Very important that those doses are not missed. And Lamisil is an antifungal. And then we have Prozac and Prilosec. Prozac being an antidepressant, Prilosec being an acid blocker. So if you look through the list, we have names that are in lowercase, we have names that are uppercase. For a practitioner, that's very easy to see that one's a generic, the other one is a brand name, but for the average person, they do not understand that. So we do have to be clear in our communication when it comes to prescribing medications. And lastly, sometimes the shape or the color of the pill are very similar to each other, but they're very indeed two different pills. What can be done to clear the line of communication and make sure that your patient is getting the right doses and medication is for them or their caregiver to keep a log of the date, time, dose, and the correct name of whatever they're taking, whether it's generic or brand. Something that's also very helpful is keeping a log of visits and maybe a summary, because it can get very confusing, and our memory is not going to serve us well with all these details as far as what the person is supposed to take, for what and why. Something that can help our elderly population whose vision may be declined is to have easy to read large labels. That way, the patient themselves and the caregivers can make sure that they are consistent in what is being administered. I did talk before about trying to maintain the same caregiver if possible, whether the patient is at home or in a nursing home or with family. And the last 2 points are really for the practitioner themselves, and that's to go low and slow. If you want to start the patient on a medication, you don't want to start at a high dose. It's probably safer to go at a lower dose. That way you can gauge their response to the medication and also not confound your understanding of which drug is doing what. And something that's also very important when an elderly patient is new to you is spend the first and or second appointment going over all the medications and review that list periodically, because 9 times out of 10 you will be removing, adding, or clearing the understanding of what the patient's supposed to take. Sometimes a lot of these patients don't even remember what something is for or why they're taking something. So you can definitely clarify that list for them and get them onto a better regimen. And that concludes our presentation.
All right, thank you, Dr. Paranel. We at Revolutions Naturopathic, we are offering telehealth, and we are also available for free coordination meetings. If you'd like to get more information about that, our number is area code 916-351-9355, and any of our medical assistants can give you more information about how that works. And if you want more information about some of the other things and the other doctors in the office and the other things that we do, our website is revolutionsdocs.com, revolutionsdocs.com. We're here to answer any questions that you have, and we hope you got a lot of information out of this. Thank you very much.
And that concludes our presentation on polypharmacy. If you have any questions, or if you'd like to become a patient, or you'd like to get an elderly person in your family or in your community to be seen here, call us at our office at 916-351-9355, where a free 15-minute consultation can be coordinated, and ask for Dr. Paranel. And if you would like to visit our website, it is www.revolutionsdocs.com. That's REV as in Victor, OLUTIONS as in Sam, D as in dog, OCS as in Sam.com. And you can also visit us on our social media sites, Facebook and Instagram.